Hi, I'm Mike Gray. I work for Health Education England in the National Portfolio Office as a Capability and Resourcing Manager. I also sit on the steering group for the NHS Project Profession Programme. And backed by popular demand, we have Henry Wilson from University College London Hospitals NHS Foundation Trust. And Henry's going to share a short case study on the impact of COVID-19 over the last couple of months. So welcome once again, Henry.
Mike, thanks very much. It's good to talk to you again.
You too, absolutely. It's a pleasure and an honour. So please share your case study. Tell us all about it. Tell us as much as you can.
Thanks, Mike. This case study is about video clinics and telephone clinics at UCLH. We obviously, with the onset of COVID-19, needed to try and keep our patients and our staff at home as much as possible. And previously, our outpatient appointments, which run into sort of like about 1.2 million a year, would have largely been done face-to-face. And so over the period of about 4 weeks, we significantly ramped up the number that were conducted over the telephone and also via video link, so that both the patients and the clinicians could carry out the consultation at home. Patients could still be seen, the care could still be provided, but we implemented new processes and technology that allowed them to do this remotely.
Wow, 1.2 million, that's some volume, isn't it? And still actually getting people's consultations going on at a time of uncertainty and pandemic really is absolutely amazing. So tell us, can you share a few key stages that were involved in that and any project methodology or project skills that came into play on that?
Yeah, interestingly, this was a bit of a mixture between a sort of a traditional waterfall approach and also a bit of agile implementation, because the project was already in progress. We were already trying to increase our capability, especially in video clinics. So it had been planned out insofar that we'd done a lot of engagement during the mobilization phase, absolutely critical to get that clinical engagement. We'd done technical feasibility to look into potential suppliers. But then when COVID hit and we needed to rapidly expand the number of video clinics that we could do, we then had to move more into an agile type approach where we rapidly looked at the different options, tested them, tried them out with people, refined them. And what I found really, really interesting was that sometimes, especially when you're trying to introduce a new technology like this, perfection can be the enemy of good, insofar that you try and spec something with all the bells and whistles, whereas actually we just needed something simple that easily allowed patients and clinicians to connect with each other.
Fantastic, Henry. Hybrid by the sounds of it. And simplicity is key often in situations of uncertainty when you're trying something new. It's amazing how people can come together quite quickly, particularly in the NHS when it can be seen to be quite a slow-moving, progressive kind of entity. I think we've seen a lot of that fall by the wayside to allow things to happen. So perhaps we do more of that, providing the patient's kept safe and there's the right governance in place. So if you to start that project again, Henry, is there anything you'd potentially do differently?
I don't think so. A couple of the things that we learned was that we needed to really, really focus on the benefits. So the benefits needed to be clear upfront and threaded throughout the project delivery. And in fact, we're doing a bit of sort of like post-implementation analysis. We are surveying clinicians, surveying patients on how they found it so that we can collect information to refine the process going forward. And I think training and embedding, when you're changing significantly the way that people work, you need to make sure that they've got at-elbow support throughout sort of, the implementation and post-implementation period. That was a bit of a challenge because obviously people were not together. We couldn't actually physically be at people's sides, helping them to use these different tools and ways of working. But we provided enough resource that there was support in place where people were either using it for the first time or they wanted to use more advanced functionality. And I found that was really, really critical. So making sure always there's plenty of capacity to help people get used to those new ways of working.
Fantastic. Absolutely brilliant, that, Henry. And what positive impacts have you seen as a result of those changes, Henry? Both you, the team, and the organisation.
So, like I said, it's been able to keep our patients and our clinicians safe, but we've also been able to keep our services running. So, when it comes to the recovery phase, we won't have as much catching up to do that we might have otherwise had. And people have responded really well to it. The feedback that we've had from the survey is that people like the flexibility. It gives them more choice. We often have patients come from a long way to UCLH, and it saves on their travel time, their costs, carbon footprint, all of these things. So we've seen a lot of wide-ranging benefits, and we're doing our best to illuminate those so that we can build on this and give patients more choice as to how they're seen and where they're seen, and give more tools to our clinicians so that they can run their clinics as effectively as possible.
All that in 2 months, absolutely brilliant. I think that's anyone that's watching this, I'm sure, can draw some experience from that. So what's next?
So we're hoping to build on this work and make it sustainable. NHS England have actually set a 5-year target that the NHS should have at least 30% of outpatient consultations, either via video or via the telephone. And we're already at that level. So we are basically putting things in place so that our teams can sustain that level of activity with these non-face-to-face appointments.
Well, thanks for taking time once again to chat to us, Henry. I really appreciate you taking time out to do that and share your experience post-COVID with myself and the community.
Thanks very much, Mike. It was great to talk to you and to talk about our experiences at UCLH. And hopefully it's given others a bit of food for thought.
There is a link that will be shared at the end of this video for Henry's case study and other case studies from the Project Profession Programme members. Please take time to listen to them, share them with your colleagues, and draw some experience. So be curious about that. And if you have any questions, you're welcome to get in touch with a member of the Project Profession team. Thanks for listening, and stay safe.